This is Dr. Judson Brandeis from BrandeisMD and Pornhub Wellness. A surprisingly broad range of factors can delay ejaculation. Imbalances in hormones and body chemistry. As a man ages, ejaculations tend to take longer. Low testosterone and thyroid hormones can delay ejaculation. Drinking alcohol before sex can delay orgasm. And medications can definitely delay ejaculations. These can include 5-alpha reductase inhibitors like Propecia, Proscar, finasteride, and Avodart, alpha blockers like Flomax or Rapaflo, anticholinergics like Detrol and Vesicare, antidepressant drugs, especially selective serotonin reuptake inhibitors, which are frequently taken for premature ejaculation, anti-epileptics, antihistamines, antihypertensive, antipsychotics, anxiolytics, monoamine oxidase inhibitors, muscle relaxants, and opiates. The issue is, make sure you check the list of side effects on the medications that you take. Issues with physical health. Infections of the urethra, prostate, or testicles can delay ejaculation. Conditions that affect the nervous system, such as diabetes, multiple sclerosis, radiation therapy, pelvic trauma, prostate surgery, retroperitoneal surgery, or spinal cord injury, can delay or eliminate ejaculation. And physical or developmental abnormalities present from birth can also play a role. There are also psychological factors like depression and other types of psychiatric disorders. Unrealistic expectations. There frequently is a disparity between the reality of sex with a partner and their preferred sexual fantasy during masturbation for many men. And concern about pregnancy, performance anxiety, fear of intimacy, sexual orientation conflicts, shame, and guilt can all delay orgasms. So what can you do about it? For men with delayed ejaculation, there's personal distress, but there are several treatment options to improve the situation. So try this first. Try strengthening your pelvic floor. Kegel exercise programs strengthen the pelvic floor and bolster orgasm muscles. You can find how to do these exercises in men at the UCLA Urology website. There are exercises enhancing and coordinating mind-body responses, relaxation and breathing techniques that allow you to focus better on pleasure. Tantric yoga is an excellent example of something which incorporates all of the above techniques. And if that doesn't work, strengthening core muscle and the pelvic floor. The M-Cella chair by BTL uses very strong magnetic field to contract muscles. The FDA approved the chair to help women with incontinence, and also it has been shown to improve sexual function in women. The manufacturer developed a protocol for men that I am studying at BrandeisMD on men in my office. I hope that it will boost the intensity and duration of the male orgasm. Make sure that your body chemistry is balanced. Check free and total testosterone levels and make sure that they are adequate. I prefer my patients have levels at least 400 or higher. Test thyroid levels and replace thyroid hormones as needed. And as we described earlier, antidepressant medications delay ejaculation. If this is an issue for you, consider alternative therapies to SSRIs. Now, sometimes there are underlying psychological issues that can get in the way of an orgasm. Visiting a sex therapist can help a man address his psychological issues that are getting in the way of climax. Suppose the problems are related to the couple's interaction. In that case, couples therapy and the use of interactional techniques can improve the sexual experience by enhancing the interpersonal bonding in the relationship and the emotional quality of the sexual encounter. In some cases, unrealistic sexual fantasies and images can make it difficult for real sex to live up to expectations. It's essential to readjust to normal and typical rather than the fantasy. And in the same way that women can be stimulated to orgasm by vibrations, male vibrators can help achieve climax. I remember one couple who came to see me because it typically took 3 hours for the gentleman to ejaculate. I referred them to a website to purchase a male vibrator. When they returned to my office 1 month later, the wife brought me a bouquet of flowers. With the help of a male vibrator, he was able to achieve orgasm in about 20 minutes instead of 3 hours. So we've learned that the primary purpose of the male orgasm is a reward for battling other aggressive males for the right to reproduce. However, humans have evolved to achieve this pleasure strictly for the sake of enjoyment. Because of this, and the finding that on average, men climax in 5 minutes, whereas women climax in 17 minutes, premature ejaculation has become a liability. I hope that the suggestions in this chapter are useful in prolonging ejaculation. However, it's also essential to incorporate and master other sexual techniques in addition to penetrative intercourse so that you and your partner will be satisfied. On the flip side, as men age, it can become difficult to achieve orgasm. However, there are also technologies and medication to assist in this endeavor as well. Please don't be intimidated or ashamed of trying something new. Congratulations on reading this and other articles in this series. It means that you take your sexual health seriously and seek advice from a reputable source. For more information, please visit BrandeisMD.com or AffirmScience.com. Stay tuned to Pornhub Wellness for additional articles, and please suggest further topics and send in your questions. In my 25 years, I've seen a lot, and if I don't know the answer to your question, I'll consult one of my colleagues. Your sexual health is important to me and to Pornhub. Thank you.